Welcome to the Doctoring 1 Abdominal Cluster Exam. After explaining the rationale for the exam, ask the patient to lie down on the exam table. Be sure to extend the footrest as the patient is lying down. While it's never a bad idea to use a drape during the abdominal exam, this is particularly true if the patient is wearing a dress, a skirt, or is otherwise exposed from the waist down. Here I demonstrate how you can provide a sheet to use as a drape as he gets into position. Always stand on the right side of the patient during the abdominal exam, and with the patient lying comfortably, start inspection by asking him to raise the shirt or gown. Be sure that you're able to visualize from just above the xiphoid process superiorly to the symphysis pubis inferiorly. This may require you to ask permission to undo a belt or a drawstring. Inspect the contour of the abdomen for any pulsations, scars, rashes, or any obvious masses. Note that the umbilicus is one landmark that you can use to partition the abdomen into 4 quadrants. Also that there are several regions to be aware of. One is the epigastric area, the periumbilical area, and the suprapubic or hypogastric area. Before moving on to percussion or palpation, we're going to first auscultate for bowel sounds. We're going to use the diaphragm of the stethoscope, and there's no specific region that you need to auscultate since the bowel sounds transmit widely through the abdomen. Listen for at least 1 minute or until you hear bowel sounds. Next, move on to percussion. Percuss over the 4 quadrants, noting any areas of relative tympany, such as the gastric bubble and the splenic flexure. We're going to finish percussion by percussing the liver span. This will be helpful later when we try to palpate the liver edge. To percuss the liver span, first identify the mid-clavicular line. Start percussion at the level of the umbilicus and move upward until you hear liver dullness. Mark this point with a pen or have the patient hold a finger on the position. Then continue upward until liver dullness turns to lung resonance. Record the span in centimeters. Normal span is approximately 6 to 12 centimeters at the level of the mid-clavicular line. Finally, we move on to palpation, starting with superficial or light palpation. If the patient was pointing to any area of pain earlier, examine that area last. When performing light palpation, position the hand horizontal to the ground and push down approximately 1 or 2 centimeters with the fingers in a gentle dipping motion. Do this in all 4 quadrants. Assuming there was no significant tenderness to light palpation, move on to deep palpation using 2 hands. The bottom hand in contact with the skin passively senses the underlying structures, while the top hand provides the downward pressure. You're going to do this in a rolling or sliding motion to a depth of approximately 4 to 5 centimeters. Palpate the liver edge by first placing the left hand under the 11th and 12th rib. Place the fingers of the right hand lateral to the rectus abdominis muscles and below the level of the previously percussed liver dullness. Gently press up and in while the patient takes a deep breath and feel the liver as it comes down to meet your fingertips. An alternate approach is the hooking technique, where you stand next to the shoulder of the patient and hook the fingers of your right hand below the border of liver dullness and feel the liver edge as the patient inspires deeply. Try to palpate the bottom edge of the spleen by first reaching over the patient with your left hand and under the 11th and 12th rib. Place your right hand below the costal margin on the left side of the abdomen and press in towards the spleen while the patient takes a deep breath. If there was significant tenderness to light palpation, assess for rebound tenderness. This is done by palpating firmly and slowly in an area of the abdomen away from the pain, then quickly withdrawing the hand. The test is positive if the patient has significantly more pain during the withdrawal of the hand. The final maneuver is to assess for costrovertebral angle tenderness, or CVA tenderness. This is performed by placing the palmar surface of the fingers of one hand on the costrovertebral angle and gently striking with a closed fist of the free hand.